Hi, my name's Kristen Holland-Shear here at UT Southwestern. Welcome to our Facebook Live chat on pancreatic cancer. We're here today with Dr. Shalom Beg, who is an assistant professor at our Harold C. Simmons Comprehensive Cancer Center, as well as a medical oncologist and a GI cancer specialist. So please, as we go along, please ask questions in the comments, and please like and share the content as we go. So I guess first of all, Dr. Beg, maybe you could talk a little bit to start us off about how common is pancreatic cancer?
Sure. Thank you, Kristen. So if you look at the number of pancreatic cancer cases that are diagnosed, about 50,000 new cancer diagnoses every year. So it makes pancreatic cancer the 8th or 9th most common cancer. But what's really troubling that sets pancreatic cancer apart is that it's the 3rd highest cancer killer amongst Americans, even though it's not the 3rd most common cancer. So by far a much larger proportion of patients who are developing pancreatic cancer will die of their disease compared to many other cancers. This is one of the few cancers whose incidence is rising. We have many more pancreatic cancer patients being diagnosed every year, and we're not seeing improvements in survival the way we have with the speed with which we have for other cancers like breast cancer and colon cancer.
Do you know why we're going so much higher? What can we attribute the rates to?
So with regards to who develops pancreatic cancer, so what are risk factors for pancreatic cancer? One of the big ones is BMI. So obesity puts you at risk for pancreatic cancer. That could be part of why our rates are going up as our demographics change, as our patients' physical status and all changes as well. But I think the other thing is that we know what contributed to breast cancer rise. It was like hormone replacement therapies. We know smoking led to lung cancer. So when those risk factors were taken away, those numbers came down. And we don't have that kind of a risk factor for pancreatic cancer the way we do for the other cancers. So part of it's that. Secondly, it's also our changing demographics with having more baby boomers, more elderly patients. And we're now finally getting to where there are some comprehensive approaches to try and understand what's driving pancreatic cancer and understand how it's structured, what are the mutations, what are the changes in the cell that are driving the cancer. And I think we're going to reach a tipping point very quickly. I think the tipping point is around the corner. You see all the buzz around a lot of new treatments that are being tested for pancreatic cancer. I'm hoping that will change. But we still need better early detection. We need better screening. The way we have colonoscopies and mammogram for colon and breast cancer, we don't have that for pancreatic cancer. So we need to identify more pancreatic cancers earlier so we can improve their survival, and like you mentioned, also identify who's at risk for developing so we can screen them better.
Okay, so one of the questions that came in right before we started was people were wondering, where is the pancreas and what does it do? Why is it important?
So the pancreas sits sort of in the back of our belly, under the diaphragm, behind a lot of the structures right by the stomach, it really has many different functions. One of the major functions is to help manage our glucose levels. So it secretes hormones that help your glucose go up and bring it down, and it's sort of a master thermostat or regulator of glucose levels. It has a lot of other roles as well. It secretes a lot of juices, a lot of enzymes that it pumps into our intestines that help us digest our food better, digest fat better, and help us lead normal GI function. And then there are a lot of other types of hormones and enzymes that the pancreas makes, but glucose control and digestion are probably the big umbrella terms that we can use to understand what it does.
So it looks like Leanne is talking. She says that yes, early detection is key. Maybe we could talk a little bit more about that. What are some efforts? Maybe are there any new efforts coming?
So there are two components to early detection. First is, do you screen everybody, or is there a way to figure out who are the patients who already have a slightly higher chance of developing pancreatic cancer and focus on them? An example will be lung cancer screening. Lung cancer screening failed when we tried to screen everybody, but when we started screening only patients who had specific risk factors like smoking, then we were able to see that screening really makes a difference. So early detection is key. I think awareness is the first key. People should be aware if they had a family member with pancreatic cancer, first degree relative, more than one family member who had pancreatic cancer. If they have even breast cancer history, melanoma history in their family, that increases the chances of pancreatic cancer. So being aware, knowing that that's a possible diagnosis is important. Doctors need to be more aware. That should be on their radar for someone who has new onset diabetes and weight loss. Looking out for them. But we know, again, for breast cancer and colon cancer, if someone has a high risk, here are two very good screening tests for us to do. For pancreatic cancer, even if we know that for someone the chance has gone from 1% to 5%, what do we do? Do we do an endoscopic ultrasound or CT or an MRI? All right, if you figured that out, how often do you do it? Do you do it every 3 months, every 3 years, every week?
Right.
So those questions haven't really been answered for pancreatic cancer, but knowing what one's individual risk is, understanding one's family history and one's own circumstances, and then talking to your doctor about what can be done is important. And depending on the individual patient and what their risk factors are, their healthcare team should be able to come up with a strategy.
Okay.
And it's important for that strategy to be iterative, where we can understand what the results were and come up with plans accordingly.
Well, one of our commenters was asking about the type of strategies, and she was also thanking you for your work. I mean, what are some of the things some treatments that are available now?
So, firstly, nothing that we do is possible without support from the NIH, support from foundations like the Pancreatic Cancer Action Network, Lustgarten, and then support from patient communities and advocacy groups. There are many different strategies to try and tackle pancreatic cancer, because I keep going back to the same analogy for breast cancer, lung cancer, colon cancer. Those patients have many more options than someone with pancreatic cancer has, and that has to change. It will change. It's in the process of changing. It's not acceptable to be in the situation that we're in right now. From many perspectives, pancreatic cancer is in the Stone Ages. I think for the last 2 years, with a lot of studies coming up, understanding what the genetic mutations are, what kind of expression we see on the tumors, and etc. It's changing. More drugs are coming to the market, and you're seeing a lot of pancreatic cancer specific programs pop up at big centers. It's becoming a priority for cancer centers to help address this. Everyone's tackling it from a very different strategy, based on what their science says, based on what their animal model says, based on what mechanisms and pathways they understand well. One kind of disappointment in the pancreatic cancer field was with immunotherapies. And immunotherapies have really revolutionized how we treat melanoma, lung cancer, kidney cancer, bladder cancer. And we were hoping that we would see that difference in pancreatic cancer. And so far, the studies that are coming out have not been as encouraging as it's been in other cancers. So I think it's a question of understanding how to use immunotherapies in pancreatic cancer. It's not going to be those drugs by itself. It's going to be most likely combinations of those drugs, either with radiation or with chemotherapy, and it will have to be in specific groups of patients.
Okay.
And we are learning more and more about that as time goes by. And there are many trials that are out there, and there are many resources available online which will help a patient who is newly diagnosed or not newly diagnosed navigate through rather murky waters and find a trial for them. And that's one of the services which we provide to our patients as well, is to help them find trials that are appropriate for them.
Well, we actually, one of our questions, so Christina was wondering, she says, for those of us who aren't healthcare professionals or scientists, what can we do to support the cause and help reach that tipping point you were talking about earlier?
So what the biggest driver for pancreatic cancer research is the federal government. And
Okay.
it doesn't matter where you are on the political spectrum, the NIH is one of the largest funders of basic research, and any discoveries that are going to be coming into the lab that will change pancreatic cancer outcomes, they're going to start in the lab. They're going to be basic science discoveries, and those are mostly going to be funded by the federal government. We're in an environment where there are budget cuts, sequester, reprioritization of resources, because we're dealing with limited resources. But to make sure that our representatives, our government understands the importance for funding to the NCI, the National Cancer Institute, because that's critical to keep research going on, so that young investigators who are who are going to be discovering new treatment strategies in the lab or in the clinic have the resources to ask questions and have them answered is important. Other than the federal government, there are foundations that are looking for support as well. So engage your local organizations, and an example would be the Pancreatic Cancer Action Network, and engage your local affiliates to see what can be done. How do you approach your representatives, your senators, your congressmen, to make them aware? And one of our big successes with such advocacy efforts was the passing of the Recalcitrant Disease Act 3 years ago, which secured funding for the NCI for a couple of years. I think that's not enough, and that money has gone for other research over the last couple of years, but still, it's a great start. And we're seeing a lot of pancreatic cancer foundations starting to understand that everyone needs to come together with a common voice, and then look for those opportunities in town. Talk to your congressman. Use these channels, because that's how you're more likely to get your voice heard. So those are the strategies, and I would say for every individual person who's trying to see what they need, what they can do, think about their skill level and their personal expertise, and see how they can use that. If you don't have to be a healthcare professional to help improve outcomes for pancreatic cancer. You could be someone who's a good writer, developing portals and avenues for people to share resources and to make original content available for other people's review is important. If you're good with website development, developing portals for patients to communicate with each other and communicate with their their health providers and other health providers. So see what your industry is, see what your skill set is, and there will be a way that can be used to help for this cause.
That's actually a really good segue. I wanted to first of all thank the Dallas-Fort Worth affiliate of the Pancreatic Cancer Action Network, and Let's Win PC. They're two organizations that joined together with us for this Facebook Live event, so thank you for that. And also, don't forget to ask questions. Please, like and love the discussion as we go along. We've got about 5 more minutes to take some questions while we have Dr. Begg here. And again, thank you for being here. So I guess one of the things you talked about and that came through a little while ago was people were wondering about clinical trials for pancreatic cancer. How do they find out about those?
So there's a website, www.clinicaltrials.gov. Every clinical trial that's available in the United States has to be registered on clinicaltrials.gov. Clinicaltrials.gov can be overwhelming to try and navigate, but you can go to disease site, you can put your zip code in, you can find what's available, and you can take that list to your physician, and they can help navigate that. That's one thing that anyone can do right now while they're watching this feed. There are other services that are available, such as PanCan's patient portal, that will do that legwork for you. Those are other ways of doing that. But when it comes down to choosing a clinical trial, I think the number of patients who enroll on clinical trials of pancreatic cancer is less than 10%. we're not going to change the way we're treating pancreatic cancer unless that number moves up a little bit.
Okay.
One of the questions I get a lot is, how do you choose between clinical trials? And I think every center, every physician, every team that's close to a clinical trial, it's like their baby. They will obviously be biased towards it. So get your information, think about it, ask questions, and see what you feel most comfortable with. One of the things which is important for me, and I say this to my patients, is location. Clinical trials are clinical trials because we don't know whether those strategies work or not. I would always encourage my patients to look for opportunities that are close to home, that are not going to break the bank, they're not going to destroy their social setup, there's the structure of home and friends and family and living and driving. So look in your area, and clinicaltrials.gov, Patient Central, those are resources that can help figure that out. And there are some trials where you can go get an opinion, come back and continue with those treatments. Sometimes those are options. But the first thing is to ask the question.
Right.
Ask your doctor, is there a trial that I'm eligible for? We sometimes hear that patients believe, or they're told that you're not there yet, and we'll ask about a clinical trial down the line. And I think that clinical trials should be the first thing we talk about, not the last thing we talk about.
Okay. So one thing that's come up, I think there are a couple of our donor groups that are following us, and they're wondering how people can support you here at UT Southwestern. Can they donate directly to UT Southwestern? Can they enroll in clinical trials as healthy participants? I mean, how can we support your work?
Boy, there are many ways to help support, and I think one way is exactly how what you had mentioned is we have strategies to get biopsies that can then be available for our researchers and our scientists to ask questions and to develop and develop new treatment strategies. So for patients who have their surgery here, for example, have had their biopsy here, we do try and bank that tissue, and we do make it available. And pancreas cancer, there's a lot of demand for pancreas cancer tissue here at Southwestern. Okay. In terms of resources and developing those resources, we do have opportunities available on our website through the Office of Development, and we do have GI cancer research pools which we can then siphon off to people who are asking specific questions, and donors can tell, this should go for GI cancer research or pancreatic cancer or breast cancer research, and that money will be directed accordingly. We do have a PanCan 5K coming up on Sunday, so we have a team, support our team that will go in helping PanCan with their efforts. We have been very proud recipients of 4 grants from the Pancreatic Cancer Action Network. So money that the DFW PanCan Purple Strides raise goes in allowing us to compete for that money on a national level and bring it back to DFW and fund clinical trials, which will then help patients from our communities. So you can do this through the PanCan Purple Stride website. Our team is UT Southwestern Purple Army. But
how many people do you have on your team?
I lost count. I think we've crossed 45, or I don't know. Have you guys checked? Anyone know? I think we have a fairly healthy, and I think I'm very proud of my team. I really am, because our team, I believe, is the only team. Of course, I'm biased, but we have I have patients, I have family members, I have basic researchers, nurses, physicians, colleagues, and it's a fantastic collection of people who have really come together from different walks of life.
Yeah.
Healthcare professionals and not healthcare professionals who've come together, and I think it's going to be a very exciting event.
Awesome. Well, we've got a couple more questions. This one's from Hollis, and Hollis says that I've read an article that said low-dose aspirin may reduce the risk of pancreatic cancer. Is this something you've heard of or would recommend for people at risk for pancreatic cancers?
The data for aspirin for pancreatic cancer is is evolving. We have a lot of data for aspirin preventing colon cancer, which is probably stronger than that. So from that perspective, it's something which one can consider. I think if someone's having side effects from the aspirin, like bleeding or abdominal pain, I would not really recommend that. But talk to your doctor, see if that's something which is safe for you to try. And generally, an aspirin is benign enough that yes, that's something that you could do. But can I really quantify how much of a difference aspirin is going to make? Those studies haven't been done. But there are strategies looking out for that. I think understanding what the risk factors are. So we know there's some risk factors you can't change. Being African American increases the chances of having pancreatic cancer. Age does, male gender does, but we can't do anything about those risk factors. But we can do stuff about our lifestyle, smoking, alcohol, and seeking excessive alcohol consumption, and talking to our doctors about what we can do to help evaluate ourselves for pancreatic cancer.
Okay. Well, I think that is about all. I think that's all we have time for today. We're running out of time. Yes. Well, thank you very much, Dr. Begg, for doing this today. And thank you to the PanCan Dallas-Fort Worth group and for Let's Win. And tune in at next time for our next Facebook chat.
Thank you very much.